Today's SnapOrtho sketch is going to be covering periprosthetic hip fractures. The grandma following in front of the Vancouver sign with her post-op hip dressing still in place will remind us that this sketch focuses on the post-operative Vancouver classification for periprosthetic femur fractures. As we enter the house, we head to the kitchen, our recurring theme for type A. Here we are met by our greater and lesser pirates from our intertrochanteric fracture sketch, symbolizing Vancouver A fractures occur in the trochanteric region. Fractures in the lesser troch area, known as Vancouver AL fractures, are treated non-operatively, which is why our lesser pirate is holding the notepad, our recurring theme for non-op management. On the other hand, our greater pirate is holding both a mallet, our recurring theme for surgery, and a notepad. The notepad has a less than 2 centimeters written on it to remind us that Vancouver AG fractures with less than 2 centimeters of displacement can be treated non-operatively, usually with protected partial weight bearing and trochanteric precautions, meaning avoiding active abduction to prevent displacement of this fracture fragment. Vancouver AG fractures with greater than 2 centimeters of displacement are treated with ORIF, typically with a claw plate or cables. The living room is our recurring theme for type B. The plant and soil will represent our implant, and the pot will represent the surrounding bone. Type B fractures occur around the stem or just below it. Vancouver B1 fractures occur around the stem as shown by the cracked pot, but there is good surrounding bone stock and the stem is well fixed. Our second pot represents Vancouver B2, where the plant and soil is falling out of the pot representing a loose stem, but the pot remains intact, symbolizing good surrounding bone stock. The third pot represents Vancouver B3 fractures. Notice how this pot is old and crumbling with the plant and soil falling out, representing poor bone stock and a loose stem. Vancouver B fractures are all typically treated with surgery, as represented by our kid jumping on the couch and holding a mallet. The toolbox is our recurring theme for ORIF, which is a treatment for B1 fractures. The wire and claw around the pot should help recall the importance of cerclage wires and claw plates. As we head to our Vancouver B2 pot, we have a new wheel, which is a recurring symbol for arthroplasty. Since this stem is loose, the treatment would be revision to a long porous coated stem, and the new tire is very thick and porous coated to help us remember the treatment of Vancouver B2 fractures. As we take a look at our Vancouver B3 pot, recall this pot has poor surrounding bone stock and a loose stem. One treatment option for Vancouver B3 fractures would be a femoral component revision with proximal femoral allograft, also known as allograft prosthetic composite. This is represented by the new cement applied around the crumbling pot. Another treatment option for our Vancouver B3 fractures would be a proximal femur replacement, which should be considered in more low-demand elderly patients and represented by our elderly man holding a PFR bag of soil. So now we'll head up to the bedroom to talk about our last part of our Vancouver classification. The bedroom is our recurring theme for type C. Vancouver C fractures occur well distal to the level of the prosthesis, which is represented by the plant stand being broken well below the level of the pot. Vancouver C type fractures are treated with surgery, as shown by the girl holding the mallet, our recurring theme for operative intervention. The toolbox on the bed with the plate and cerclage wire should help remind you that Vancouver C fractures are treated with ORIF. And that concludes our sketch on the post-operative Vancouver classification of periprosthetic hip fractures. So next time you're headed up to British Columbia, just think of Grandma's house and you'll remember the Vancouver classification for the management and treatment of periprosthetic hip fractures.